Welcome back as we continue our conversation with Representative Ayanna Pressley. So Massachusetts has new leadership with Governor Maura Healey and Lieutenant Governor Kim Driscoll. Congresswoman Pressley, how do you plan to support this new history-making administration to address critical issues for your district like the T and the housing crisis?
Well, I'm excited to build upon our working relationship in the past and their respective prior roles. And so I'm very excited about the Healey-Driscoll administration and the opportunity to build upon those shared priorities. I've already met with the governor and Lieutenant Driscoll on many of those things, from mitigation of the climate crisis to investment in multimodal and public transit infrastructure, to investment in more resources for housing that is affordable, in my role in the Financial Services Committee, and certainly in protecting reproductive justice and abortion access, to name a few. So we've already met. We'll continue to meet. And I certainly will need their leadership and their partnership in the corner office during these consequential times, especially when I see so much of what we'll be doing in Washington will be the work of harm mitigation for the next 2 years.
The 7th Congressional District includes parts of Boston, most of Cambridge, parts of Milton, Chelsea, Everett, Randolph, Somerville. And you've said that it's the most unequal district in the Commonwealth and one of the most unequal in the nation. Can you speak to that now and how you represent the needs of such a diverse constituency?
This is, the Massachusetts 7th is a vibrant, diverse, and dynamic district. And yes, one of the most unequal districts in the country. We're in a 3-mile radius from Roxbury to Cambridge. Life expectancy drops by 30 years and median household income by $50,000. That is as the result of an under-resourcing. And so I remain squarely focused on delivering those federal dollars and have done that to the tune in my 4 years specific to community project funding or earmarks of $23 million to make those investments in everything from tuition-free community college, $1 million investment at Bunker Hill Community College, to $1 million investment at Dimick to address substance use disorder, to a $300,000 investment in Chelsea at Chelsea Collaborative to support workforce development, $300,000 at Benjamin Franklin Institute around green automation. So these are just some of the examples that I would lift up. Those inequities, again, have a lot to do with the fact that these communities have historically been under-resourced, which has not supported an ecosystem and communities where everyone can do more than survive, but can thrive. And so those federal dollars are really key. And that was also something that we spoke about in my meeting with the Healey-Driscoll administration.
Bringing home the money to the district. Let's turn to migration and immigration. Now, when the Supreme Court upheld the controversial Trump-era border restriction called Title 42, keeping it in place, you had a strong response, and you tweeted in part, Title 42 is a racist and inhumane policy that has inflicted hurt and harm on migrants, especially Black and brown migrants, for far too long. Now, the Biden administration has expanded restrictions beyond what the court ruled, and we can all agree that there is a crisis at the border and that cities like Boston are absorbing new residents, and it's placing an additional strain on housing, medical, and other resources. What do you propose as a next step for our borders and for immigration reform?
Well, I represent the 3rd largest Haitian diaspora in the country, and I'm very proud to serve as co-chair of the House Haiti Caucus. And let me just say emphatically that Title 42 is an unjust policy. Our unjust immigration system has already disproportionately been borne on the shoulders of Black and brown migrants. And I reject Title 42 in any iteration or by any name. Asylum is a legal right, and immigration is essential to this country. That being said, there are many fault lines because our current system is one that is unjust, does not center the humanity and dignity of people, and ensure a safe pathway to citizenship for all. So I think there's much that needs to be done, including us acknowledging the roles in which U.S. foreign policy has contributed to this crisis, what I consider a humanitarian crisis. And so ultimately what we need is for Congress to act. Congress must act so that we do create a system that is just, that centers the humanity and dignity of all. And Karen, just locally, I want to say that it's important that we continue to make those investments to support community-based organizations, that my partners in government, mayors, continue to support migrants that are here. There was a lot of focus on those that came to Martha's Vineyard, but Haitian migrants have been showing up and at our hospitals and in community for many, many months, and are in dire need of housing, of legal services, and of healthcare services. And so it's important that we are supporting those community-based organizations and meeting the essential needs of those migrants.
Before we leave this segment, I want to ask you this one last question. We're in what is being called a triple-demic. Children especially been affected by cases of flu, RSV, and of course COVID-19, and in the midst of it, a shortage of acetaminophen and ibuprofen, and families are being met with empty pharmacy shelves. Now, you and other lawmakers have asked for an explanation from Johnson & Johnson, the manufacturer of infant and children's Tylenol and Motrin. What has been the response?
Yes, Karen, I led this letter in partnership with Senator Warren, Catherine Whip Clark, and Representative Trahan. This is just unacceptable and unconscionable that parents are going to the shelves of local pharmacies when their babies are sick and unable to get children's Motrin and Tylenol. We reached out to Johnson & Johnson to get some answers. Because again, this is unacceptable and unconscionable. They have responded to our letter, and so we are making progress. And we'll be reporting back more on that. But I just want families to know that we will not accept this this insufficient status quo. That parents should not have to worry about whether or not they'll be able to get the medications that they need to get their babies healthy. So I'm appreciative of Johnson & Johnson's prompt response. We still have more questions, so we have more road to go here.
All right. Congresswoman Pressley, when we come back, you're going to do CityLine's 5 words or less.
Okay.
We'll be right back.